a lot of the symptoms are non-specific. Non-specific meaning that they are not specific to the adrenal glands. However, it is typically a constellation of both clinical symptoms and biochemical diagnosis. So we have to have both of them telling the same thing in order to basically say that someone has adrenal insufficiency. Symptom wise, it's low. Imagine all of these hormones that we're talking about, if they are low. So this is what happens. We have nausea, dizziness, lightheadedness, chronic headache, chronic fatigue, unexplained low blood sugar, and low blood pressure, in addition to diarrhea, loss of appetite, loss of weight. So this is a constellation of findings. Some patients have some of them, not all of them, but when you see like a multiple of those complaints together. So basically, if you see someone who's chronically fatigued, but their blood pressure is good and their blood sugar is good, then this is not adrenal insufficiency. Like, so typically, adrenal insufficiency will cause, as I mentioned, a constellation of symptoms. They don't have to have everything together, but the nausea, dizziness, lightheadedness, headache, low blood pressure, low blood sugar, loss of appetite, diarrhea, when you see a lot of these together, then this is concerning. Of course, when there is already a risk factor, we have to think about it. Like when we see risk factors, like we know someone was already on steroids in the past and then they stopped. And of course, this is wrong. We advise against that. We cannot stop. If we are on steroids chronically, we cannot stop suddenly without being tested if my adrenal gland is ready to take over back again or not. So when people have risk factors, such as, again, any of the infections that we talked about, or some people have like other autoimmune conditions. So there is a risk factor that makes us think more about the adrenal gland, might be the problem. And of course, the biochemical diagnosis is very important in endocrinology. Biochemical diagnosis, we measure the cortisol level in the body, and we measure also the hormone that regulates the cortisol, which comes from the adrenal gland, from the pituitary gland, which is called the ACTH, or the adrenocorticotrophic hormone.